Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral, fully occluding earwax, and they last attended 6 years ago, almost to the day, and they were really happy with the treatment they received last time, and obviously it's lasted them a while. Prior to that, they reported having their ears cleaned on a more frequent basis. Now, that just might be coincidence. People do go through cycles on how regularly they need their earwax clean. Now, for the majority of us, I would say between 90 to 93% of the population, earwax doesn't cause a problem. We all more or less secrete earwax. It's a natural substance secreted by the glands in the outer third of the ear canal, the sebaceous glands, which secrete sebum, which is an oily, fatty substance, quite viscous, and it consists of alcohols, cholesterols, squalene, long chains of saturated and unsaturated fatty acids. And we also find sebum on our scalp. So the hair follicles on our scalp also secrete sebum. And in addition, in the outer third of the ear canal, almost exclusively to that to the ear and also under the armpits and inner groin region, we have what we call ceruminous glands. Now, these are modified alpocrine glands, so sweat glands. They differ to the sweat glands we find on our forehead, for example, which secrete more of a salty, watery sweat. The ceruminous glands secrete a less viscous oily sweat. So when I say less viscous, that's in comparison to sebum. So it's thicker than the kind of the salty sweat we have on our brow after exercising, for example. And so the oily sweat, the oily fatty substance sebum, they combine with dead skin cells in the ear, and also loose hairs, and any other debris to form earwax. So we all kind of more like, I would say, well, I would expect all of us to be secreting these, but in different quantities and consistencies. And earwax is a useful substance in moderation. Of course, when you've got this much, it's counterproductive. But earwax, it diffuses itself the entire length of the ear canal and also the outer layer of the eardrum, which is made up of 3 membranes. So it's like a thin veneer. It's almost invisible to the naked eye. So it's a layer of wax that just protects the ear canal, prevents it from harmful bacteria and fungi. It's slightly acidic, so it almost acts as an insect repellent as well. And it helps the ear canal to retain internal moisture within the skin cells. Without that waxy membrane, moisture within the skin cells that line the ear canal will rise to the surface and evaporate, which gives us dry, itchy ears. And it also protects the ear canal from external water. So if you have too much external water, because skin it likes to absorb moisture, water, so that oily membrane, that waxy membrane prevents external water being absorbed by the skin cells, which can then macerate it and overhydrate the skin, which then bursts on the membranes and breaching that epidermal layer, which is a protective membrane in our ear. It protects the inner layers of skin. So we all have earwax for that function, but for the majority of us, earwax naturally migrates out of the ear. The ear produces it, expels it, and it produces some more, and then expels it. It's a continuous cycle. It's like a conveyor belt. That's the best way to describe it. And this conveyor belt motion occurs by the outer layer of skin in the ear, so the epidermis layer, consisting of epithelial skin cells, shedding and slowly migrating out of the ear. And this migration starts from the eardrum. So the eardrum, as mentioned previously, it's made up of the same skin that lines the ear canal, the outer membrane anyway. And as the skin dies and it sheds, it moves sideways off the eardrum and slowly exiting the ear across the ear canal. That rate of migration can vary from individual to individual and also between ear and ear and also within different parts of the ear. So it's approximately, however, 1.5 millimeters to 3 millimeters a month, and you can compare that to your fingernail growth. And as this dead skin dies and it sheds and it migrates, any earwax sitting on the surface will also migrate too out of the ear. So the ear, it should in design, through evolution, be self-cleansing However, for a small percentage of the population, so about 5 to 7%, for whatever reason, the earwax doesn't actually migrate. It could be the skin cells stop migrating, or it does but at a slower rate. So the ear produces earwax quicker than the ear can naturally expel it. You could have hyperactive ceremunous and sebaceous glands in the ear. You could have bends and kinks and potholes within the ear canal which prevent the natural migration. You could have loads of hairs in the ear which mats against the earwax, so it prevents it from working out. You could have really dry skin in the ear, so that causes friction, so again it just slows down or prevents the wax from naturally migrating out. Some people have extremely narrow ear canals as well, so the wax builds up quicker and it can't expel. People that wear earbuds or hearing aids, they can push the wax further in. Of course, if you push the earwax in yourself using your object of choice, really, because I know people that have used car keys, tips of pens, bobby pins, cotton buds, of course, cotton swabs. So that's just going to push the earwax further in. So they're potential reasons. So the left ear was clear, just doing the right side. You managed to use a hook, glided it at the roof of the ear canal in between the wax plug and the top of the ear canal wall, and I extracted that. Now, that's the patient's eardrum, and you can see it's retracted, the top part of the eardrum sucked in. That's called the posterior superior quadrant. So it's essentially the back north part of the eardrum. It's sucked in, so the patient's got a blocked eustachian tube, and we confirmed that with tympanometry. We did a pressure test which measures not only the mobility of the eardrum, so how well the eardrum and the 3 middle ear bones vibrate in response to sound, but it also measures the air pressure behind the eardrum. When the air pressure is negative, so it's less behind the eardrum compared to the ear canal, it can cause a vacuum effect within the middle ear, so the eardrum can get sucked in. So this patient just performed the Valsalva. They closed their mouth, pinched your nose and blew, not too much, just gently. There's always a risk if you overblow. It can. I've never seen it happen before, and the Valsalva is a diagnostic test that we use within audiology and ENT. But just did it gently. You can see they forced air up the nose, up the eustachian tube, and they popped the eardrum back out, and that retraction was no longer present. You saw the wax dead skin that I removed on the tissue. And I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.